McLeod Health presents Count on Health.
A DIEP flap, or DIEP, deep inferior epigastric perforator flap, is an advanced microsurgical technique that's used for reconstructing a breast. In patients that have undergone a mastectomy for breast cancer in which the breast tissue has been removed, it's a way of taking the patient's own tissue and recreating the breast. It's called a microsurgery operation because we do part of the operation underneath the microscope using small specialized instruments and hooking up blood vessels that are usually less than a few millimeters in size. The flap is taken from the patient's abdominal tissue and then brought up to the chest where the blood vessels are reconnected to some of the blood vessels in the chest, bringing life to the flap itself. Women that decide to undergo the DIEP flap can either have this done on the day of their mastectomy, called an immediate reconstruction, or some patients that require some additional treatment such as radiation or chemotherapy may elect to have this done at a separate operation after they've recovered from their mastectomy and undergone their adjuvant treatment. This is called a delayed reconstruction. Some of the benefits of the DIEP flap are: one, some reduced postoperative pain. There's a lower incidence of abdominal wall hernias or abdominal related pain compared to some other flap reconstruction. There's also the benefit of, with the DIEP flap, since it's used from the patient's own tissue, that tissue grows and changes with the patient over time. So it feels more like a natural breast, is easier to match the other breast if she's only had a mastectomy on one side as far as shape and size and feel. Additionally, it reduces the chance of needing other operations down the line once the patient's completed their reconstruction, such as in the case with implants that aren't designed to last forever and may need to be changed out at some point in the future.